The most frequent warning sign for arthritis is pain. And so for hip arthritis, most people will feel pain in what they appreciate as the front of their hip or up in their groin is what we'll frequently hear. Along with that, they'll have some stiffness. It might be difficult to put on socks and shoes because of the limited mobility. Usually arthritic pain is worse with activity and more vigorous activity such as running and going up multiple flights of stairs. Those activities become difficult for people with arthritis over time. Same is true of knee arthritis, where people will notice pain, stiffness, and then also sometimes deformity at the knee, where they'll either be kind of excessively knock-kneed or bow-legged because arthritis can affect one side of the joint more than another. As to how aggressively we treat it really depends on the person, and all of the treatments for arthritis are elective, meaning no one has to do anything unless their symptoms warrant it. So initially we can often treat arthritic symptoms with anti-inflammatory medications if the patient's able to take those, medically speaking, and injections or physical therapy. When those conservative or non-operative measures fail to satisfy their needs to get out and be more active, if they're still having ongoing pain, then that's when we can start to consider joint replacement surgery if it's appropriate. And really, in the end, it's up to the patient to decide that. There are some patients who do not have severe enough arthritis, and I say that absolutely they are not candidates for a joint replacement because it's too aggressive of a treatment for a relatively small amount of arthritis. People can have a large amount of arthritis and severe wearing of their joint, and then yes, they are a candidate in my eyes, but really it depends on their symptoms, and so I'll counsel that patient on the risks and the benefits of surgery, and then the decision is theirs. Our treatments have evolved over time in several ways. The general categories of treatments haven't changed too dramatically. There are, we've used anti-inflammatories to help with symptoms for a long time. Steroid injections have been used for a long time, and there are some small differences with medications within those categories, but no major changes there, I would say. Within knee replacement and hip replacement, we've certainly improved over the past decades. The first knee replacements were done in the 1960s, I believe, and we've come a long way in terms of technique and materials that we use that are starting to allow more longevity for our surgeries. That's certainly not universally true, and I always caution patients that newer is not necessarily better. We like to see a long track record for implants and for the different things that we do surgically before we use them on our patients. Arthritis in general is very common, so it's extremely prevalent throughout our society, and most people, if you live long enough, will get arthritis in at least one of their joints. People that do have arthritis of one joint are more likely to have it in another joint, but that correlation isn't always true. They certainly can exacerbate each other, even though they don't typically cause each other. So if someone has both an arthritic hip and an arthritic knee on the same side, or even on opposite sides, they can alter their gait in such ways that will cause increased pain, through the other arthritic joint because of how they're walking. So we do like to treat the entire patient and try to make a treatment plan that focuses on the joint that is affecting them the most to begin with.